Hey everyone, I'm Joey. Today let's talk about a new approach to treating pediatric brain tumors, CAR T-cell therapy. CAR T-cell therapy, the full name is chimeric antigen receptor T-cell therapy. The name sounds pretty intimidating, but the idea behind it actually isn't that complicated. It's even got a bit of a sci-fi feel to it. Let me quickly walk you through how it works. Step 1. Draw blood from the patient and extract the immune T-cells from it. Step 2. Take those T-cells into the lab and genetically modify them, basically installing a kind of GPS on them so they can precisely recognize cancer cells. Step 3. Mass-produce these modified cells and infuse them back into the patient. And just like that, these upgraded T-cells can zero in and precisely take out the cancer cells. But when it comes to pediatric brain tumors, this approach needs a little tweaking, mainly at the infusion step. Why? Because, like we said earlier, the brain has that blood-brain barrier, and it's hard for the immune T-cells to travel back into the brain through the bloodstream. So the mainstream approach in the field right now is to inject the drug directly into the cerebrospinal fluid, and let the brain absorb it from there. There are generally two ways to inject the drug into the cerebrospinal fluid. The first is called a lumbar puncture injection. You inject the drug into the spinal canal through the lower back. The second is where you first surgically implant a small device called an Ommaya reservoir in the head, and after that, you inject the drug into the cerebrospinal fluid through that reservoir. This approach sounds pretty simple in theory, but it's got one core challenge. Every single patient needs a custom-made batch, which makes the production cost really high and the timeline really long. Back when the first batch of CAR T products got approved in the US, it took a full 4 weeks from drawing the blood to the infusion. For late-stage cancer patients, that's just too slow. There's no time. But over the past few years, as China's medical capabilities have rapidly improved, the situation has completely changed. In China, we can now get through the entire production process, from drawing the blood to the infusion, in just a few days. That kind of speed is almost impossible to achieve within Western medical systems. And for some tumors, the cost of CAR T has come down to around 60,000 renminbi. Compared to the US, where it easily runs into the hundreds of thousands of dollars, that's basically dirt cheap. Right now in China, the main hospitals offering CAR T therapy for pediatric brain tumors are Beijing Tiantan Hospital and the Cancer Center affiliated with Sun Yat-sen University in Guangzhou. I've gotten to know the chief physicians at both of these hospitals in depth. If any of you need more info, feel free to drop a comment below. Alright, that's all for today. If you enjoy our channel, please click the subscribe button. Thank you everyone.